Now this paper has 9 references. Are they adequate? Are they good? First of all, it does let us know that it is part of the scholarly article criteria that does have works cited references or some type of bibliography such as this one. Now, in addition to finding it and knowing that this does make it a scholarly article, does this make it a great scholarly article? And what can you really determine when it's not quite your field and it's not something you know about a great deal at this time? Well, let's give a look over. Now, this particular publication was published in 2017. These are the types of things they used. This particular thing is from 2013. Often in medical type things, 5 to 3 years is the measure. So this is 4 years old. Turning and repositioning the critically ill. And it comes from the Journal of Wound and Continence, and it's in the nursing area. It seems to be quite long, and that's probably a good article. So it's talking about a literature review. What a literature review is, it's another type of scholarly article, but it's just about secondary materials. Like it reads all these articles on the same topic, and it discusses what they find. Okay, so that's probably a really good thing to read. It's a little old, but we can move on. 2006. Definitely old. Nursing care of the bariatric patient. Now, this is 2017. That's old. So you might go, that probably isn't good. And if you're doing your own work, you might want to find something newer. Like, how can I do that? You know what? You can go to Google Scholar and find the things that have cited this, and usually find things are much newer. Just a little tip, exhibiting bed width as a contributor to falls from the bed. This is from 2012. It's going to put it at 5 years when this was published. It's going to have at least, it's really brief, it's just a 3-page piece in long-term care, and it's specific to the elderly. Now let's look at this next part. See if I can move this up with it painlessly. Essential bariatric equipment, making your facility more accommodating. It's talking about it's multiple, almost 10 pages. It's from 2007. It's 10 years old. It has multiple pieces. It has editors. So it's a questionable. It seems like there might have been something newer on that. So so far it's about 50-50 on what you think is strong or not. Of course, the ultimate level is reading them yourself. So let's see what else we have. Here's the last page. 1995, the effects of small shifts in body weight and blood flow on interface pressure. It is in Research in Nursing. It's 7 pages, multiple authors, 1995. We have next one, 2015, 2 years old. It's about adults and youth in the United States specifically. And it's a 3-year study. Retrieved from the CDC. That one looks like it's probably pretty awesome. And also it's giving us a feel for the research they did to construct it. So they're looking at different things about pressure. They're kind of looking at the elderly. They're looking at the youth, which may be broad, but that might be something in their limitations that they discuss. They're looking at body weight. They're also looking at people that've had bariatric surgery specifically. So we can see their research is around those areas. And based on how you're going to use it, that may or may not be specific to you. Because one of the key parts of research and research strategy is it relevant to your topic? All right, so we have this particular thing is clinical procedures. It looks like it may be a textbook. It's 2020. That's kind of old. It's a textbook, 5th edition. It's highly likely, even when they wrote this, there was something more current. Just to give you an idea, this one's 2017, multiple authors. It's talking about pressure ulcers. Okay, so in a way, when you start seeing this, there's only 9 pieces. So they have a couple things on bariatric surgery, one thing on youth and adults, one thing on the elderly, and like one thing on ulcers. Do you know what I'm saying? They don't have like kind of a breadth and depth in this. And as a reader, you're allowed to critically think about this. Okay, so this piece is 2007. When is it safe to manually lift a patient? American Journal of Nursing. It's 2 pages. It's probably not a scholarly article specifically. You could tell from the title and the length and the single author. But a lot of, there's literature that has great value about it. Sometimes in a scholarly journal, it's in between the research and whatnot. And it's how I do this better sort of type of thing. Like how I really did it. When is it really safe? And it may mention some of the others, but it's only 2 pages long, and it gives you somebody's experience. And those can be wildly valuable. This happens to be 10 years old. and you could put question marks by that. This particular one here is 2016. It's evaluation of bed features to assist in turning and repositioning patients. It's in something called Human Factors. It's almost 9 pages long. It's probably very interesting. 2016. I think that's probably, I'd put that in the plus column. Ziffer Polisby, Allison, etc. We have multiple authors. 2004 physiological responses to the early mobilization of the intubated, ventilated, and that type of surgery stem. So it's kind of old, but it's an Australian Journal of Physiotherapy. So let's think about that. So more or less, this is how you can tell. I went to ProQuest and I did a search of bed, patient, safety, and healthcare. This isn't all the things that covered. I could done a search with bariatric things, about different things about elderly, young adult, or adults as they did, and covered other pieces. Because remember, they have 9 references. Also, what I did is just make sure it was full text. I didn't limit to scholarly journals because they also used reference works, textbooks, and some other types of formats. But what I did do is I selected what would have been the prime time for them to find materials, and that would be 2012 to 2016, as we were published in 2016. And just on this one piece, there's 117 results. And when I go through some of these topics, and I have to tell you, I just want to point out, I made bed a part of the title to kind of make it a tighter and better search. I used patients and safety and healthcare. I could have used many things, like the piece about bariatric surgery. And let me see if we're going to fix that. Aye. So, estimating bed capacity, bed exits, block beds, electrical beds, manual beds, equipment handling, bed alarms. There's so many things here that those 9 pieces did not cover, and some of them were dated. So, and this wasn't like the biggest search I could do, and this isn't even the best medical search I could do. It was just kind of, let me look at this and let me question whether or not this is good. And sometimes in your academic research, you will be called upon to analyze a piece. And this is one of the ways that you could look at the reference to figure out, did they really do the best they can? And then when you kind of put this with the ethical statement, or you see they worked at a certain place, were they aiming towards a certain ending to this particular thing or not? Like, you can question it. It's fine. It's called critical thinking. And you could take the time to go through and read some of these articles as well. So, and while we're here, ProQuest is awesome. Suppose you really like this article. It was great. You can see, of course, it's in full text. It's going to give you a citation. You can copy and correct. And it's also going to give you other suggested sources. I just wanted to let you know it's awesome while we're here looking at the works cited, references, and bibliography. So I hope this was enlightening to you. I think it was kind of interesting to kind of go through this process with you, and I hope you enjoyed it. As always, if you have a question, ask your librarian.